Let's in fact bring in Dr. Rajiv Das Gupta, part of National COVID Task Force, who's joining us here on the broadcast. Thank you very much, Dr. Das Gupta, for joining us. Some important points that were mentioned as far as the Health Ministry's briefing goes. I want to come to you on one particular aspect, home quarantine for all contacts, even though the testing rules and requirements have become less stringent at this point in time. The only question is, how is this going to be ensured? Because there is no way to ensure, if the testing requirements are coming down, that people who have come into contact will home quarantine of their own accord.
Well, there's no way of ensuring it in the sense of the regulatory or legal term, and therefore the need and space for very effective communication messages. And the communication messages should be understood in three terms. One, which is more or less top-down information education messages. Second, which is a more nuanced risk messaging. And third, which is a very wide-ranging community engagement. Now, these three are somewhat distinct things. They're often conflated with each other, but we need to do better in risk communication and community engagement. And only when one does the three in tandem and in an optimal mix that we can achieve goals of this sort.
Right. And in terms of the other worrying factor, the positivity rate in some of the states, which is seeing an extremely high jump, whether we talk about Bengal or some of the other states, that is also very crucial. How do you think that is going to play out in terms of, the spike in cases that are likely to come going forward?
No, this requires some clarification. The 5% and 10% benchmarks that we have actually date back to 1.5 years when the COVID infection came. But what Omicron has shown, and this is because of its very rapid transmission, is that we can expect this to stabilize at about 30-35% weekly average. Many of these figures that are being discussed now are daily testing rates. In South Africa, the weekly test positivity rate average was about 35% through the 4 weeks of December. And that's probably the level that we expect, which is assuming that we are testing enough. In South Africa, in the most affected parts, the cities and the very highly urban provinces, it was about 500 to 700 cases per 100,000. Now, we aren't certainly detecting numbers at that range, but therefore, test positivity rates of anything between 30 to 40% can hold for a few weeks. And that's possibly the phase that we are now witnessing. But add to this the statements coming from Delhi and Mumbai administrations that they think that it is leveling off. And therefore, the silver lining is that even at fairly high test positivity rates in the cities, the hospitals didn't get overwhelmed.
Right. And Dr. Das Gupta, that sort of brings me to the other question when we're talking about cities here. Mumbai, for example, we'll have to see what the numbers are today, of course. But the last couple of days, it has been a clear downtrend. In fact, positivity rate also has been significantly lower. How does one then assess whether we look at different cities or even in other states where the numbers are now going up? How do you decide when, how the peak is going to play out in terms of, is it going to be in pockets? Is it going to be a country as a whole?
Well, this is a situation. This Omicron-led surge is a situation which is distinct from the previous waves to the extent that we do not fall into the trap of monitoring by new cases, because cases are going to be abundant, if not astronomical, if one were really to keep testing and finding out the number of new cases. The thing to monitor is what's happening to the health service system, whether hospitals are getting overwhelmed, what's happening to moderate and severe disease, whether they're worsening, whether there are more deaths. And the third, which is the really big challenge, is how do we manage the human resource situation? How do we contain outbreaks within institutions where very large numbers of people in residential settings, such as student hostels or security forces residences, are falling ill? That really, the human resource challenge is a very big challenge over the next few weeks.
Right. In that case, Dr. Das Gupta, when would you say we would come to a stage where, we don't even need to monitor the overall cases, given that so much is asymptomatic, so many are so mild, and we only need to look at the deaths, the rate of hospitalization, and that becomes, where the telling of where we are in terms of the wave?
The point is not that we don't monitor, but the point is that we don't get unduly worried by the sheer number of new cases. What we should be worried about, and in fact, states are certainly monitoring that, what's happening to both hospitalizations as well as the clinical conditions of those getting hospitalized. That's what the monitoring tool is. And therefore, no knee-jerk reactions should be taken on the sheer number of cases or on the sheer positivity rates. Knee-jerk reactions are not going to help. What the South African situation has shown us, the administrations need to keep their cool and take it in their stride. It's going to pass off in about 4 weeks or so if the South African experience replicates here.
So in that case, what you're saying is that, no knee-jerk reactions, but at this point in time, we are seeing a lot of states imposing very strict curbs in some cases, various gradients of curbs that are being imposed right now. Do you then believe that to that extent is not necessary?
No, where we certainly need curbs is indoor spaces, which means that we actually don't have large congregations, whether it's a social congregation such as a marriage party, whether it's organizing any event, and certainly wherever we have essential services where people have to be in workplaces, such as say banks or say police stations, there we certainly, or even healthcare settings, there we certainly need to look at what's happening to indoor ventilation, because that really is the danger ground where very large number of people are going to fall ill very fast, and that affecting the essential services is what we should really worry about. It will put very significant numbers of essential services personnel out of action for several weeks.
Absolutely, Dr. Das Gupta. So essentially what you're saying is that the entire way of managing the COVID pandemic, the third wave, is very different from what we've seen in the past two waves. And we sort of need to, move ahead with a different mindset now.
Quite right.
All right. We'll leave it there. Thank you very much, Dr. Das Gupta, for joining us with your perspective.